Hello, welcome to Ask the Doulas. I am Melissa, and I'm here with Kristen, and then our guest today is Dr. Nave, who is a naturopathic doctor at Health for Life Grand Rapids. Hey.
Hi.
We were excited to meet you. What was it, a few weeks ago? We presented to your team, and I was really intrigued. So tell everyone what you specialize in as an ND, and then they'll know why I wanted to talk to you so bad.
Okay. So I am especially excited about assisting women to reconnect to their identities. And the way in which I do that is by really looking at their hormones, their mental health, their physical health, and other aspects of their life. And so, yeah, that's...
Do you only work with women?
No, I do not, but my passion is women.
Yes.
Yes.
So today you're going to talk about cycles.
Yes.
And I know you have a couple specific things about a women's cycle that you want to talk about. So explain what those are, and then let's just dive in.
Yeah, okay. So I want to talk about what a typical cycle should look like. So this is how your cycle should look if nothing is going wrong. And then basically transition to talking about PCOS and what is going on with that.
And what is PCOS?
So PCOS is polycystic ovarian syndrome.
Okay.
So when in medical terminology says syndrome, it just means a cluster of symptoms that fit this particular diagnosis. And so with PCOS, what's happening is that the woman isn't bleeding or she has skipped periods, and that is due to low progesterone, which is an important hormone that allows the endometrial lining basically in the uterus so that implantation of the fertilized egg can happen.
Okay. So let's talk first about what it should look like. And then we can talk about that.
Sounds good. Okay, so with our cycle, there are 5 main hormones that influence a woman's hormonal cycle. So we have LH and FSH, which are the hormones that are produced by the brain to tell an egg to mature and to allow the endometrial lining, which is basically the buildup of tissue in the uterus that allows the implanted fertilized egg to become a baby. So we have those 2 hormones that are produced by the brain, and then we have estrogen, testosterone, and progesterone that are produced in the ovary.
So all the time, or only if an egg is implanted?
At specific times.
Okay.
So in a typical cycle, in terms of what we would call the normal cycle or the optimal cycle, would be a 28-day cycle. We have some leeway in terms of, in the medical community, how we diagnose whether it's too long or too short, whether it be above 35 days or less than 21. For me, I think it's best if it's like 28 days because, it's kind of like cycling with the moon. So like with the lunar cycle. Because it also helps with the math. So we'll just use 28 for the typical, just for explaining what happens.
Okay.
So in the first 14 days, that's when what we call the ovulatory, like building up of estrogen. So the brain tells the ovary by way of follicular stimulating hormone, FSH, to make one of the eggs mature. So it's like, hey, ovary, let one of these eggs become the mother, so to speak.
Okay.
And so the brain does that, and then the ovary responds by allowing one of the eggs to become mature. We have multiple eggs that are responding during this time in different life stages, but the one that is, I guess, the oldest usually gets picked in terms of its life phase. And so then it becomes mature. The estrogen is being made by the egg itself, which allows for that ovulation to occur. So it's like FSH tell the egg to become mature, and then the egg itself makes estrogen so that it can further mature. So it's like this fascinating, interesting thing that's happening.
That's during ovulation?
Yes. So like during the first 14 days of your cycle, the estrogen is building up so that the egg can fully mature.
Okay.
So that's that. And then what happens is that there are 2 types of cells that are part of the egg. One produces estrogen, and the other aspect makes testosterone. So those are the other 2 hormones that we're talking about. Once the egg matures and it's released, the thing that's left behind is called the corpus luteum, also known as the yellow body. That then makes progesterone. all of this is sort of like happening at the same time. So it's like we say 14 days for the ovulatory phase, but really it's like the brain's telling the body to make progesterone. At the same time, it's telling the body to make estrogen. It's just that it's at a lower level until the egg is released. You don't really have that progesterone being made.
It's ebbing and flowing based on
yeah.
day of your cycle.
Yes. And so around day 14 is when the egg is released. It's like the highest level of estrogen at that point in time. And then the yellow body that's left behind, the brain told the egg by way of the luteinizing hormone, LH, to start making progesterone.
Okay.
Are you following?
Kind of, yeah.
Kind of.
I'm trying, in my head, that little egg is moving along, following a timeline.
So day 14, we have the highest estrogen, and progesterone starts to climb up.
Okay.
Because
and estrogen is decreasing and progesterone is increasing.
Yeah.
Okay.
So estrogen is at its peak. Progesterone starts to spike up.
Okay.
A lot more.
Okay.
I'm grossly simplifying it, and I'm sorry. So that happens, right? As the progesterone is being built up, so the corpus luteum is making the progesterone because the brain told it, hey, make progesterone by way of the LH, the luteinizing hormone. That causes then the endometrial lining in the uterus to build up so that implantation of the egg can happen. So towards day 28, which is when you expect bleeding to occur. Basically, the reason why bleeding occurs is that the progesterone starts declining at that point because progesterone is necessary for the buildup of the uterine wall so that implantation can happen. But if there's no fertilization of the egg, then it basically is a withdrawal of the progesterone, and then it just slots off.
Mm-hmm. So technically, day number 1 is that the day your period starts?
Yes.
And so 28 then is the day before your period starts.
Correct.
Okay, so I'm seeing the timeline in my head.
Yeah, so day 1, when a doctor asks a woman, okay, what's day 1 of your period, he or she's technically asking when's the first day of your bleeding time. Because technically we're always cycling, but we consider day 1 the last time you bled.
Mm-hmm. Okay.
Yeah?
Interesting, yeah.
Yeah. And so that's what the cycle should look like. Now, when we experience our periods, even though people consider it the status quo that we experience PMS, we don't have to experience it. Does that make sense? Do you following what I'm saying?
Yeah.
So like some of the
hormonal changes don't necessarily mean that we're going to have the mental and like becoming angry or disorganized or frustrated.
Yeah, and so like seeing those symptoms for a woman, that would indicate to me like maybe the ratio is a little bit off. So some examples are like acne or being really bloated. So being bloated, puffy, having like water retention, and like having really heavy bleeding, that could be a sign that the woman is experiencing what we call estrogen dominance.
Okay.
Now, estrogen dominance doesn't necessarily mean that she has high estrogen. It could just mean that her progesterone is low and therefore throwing off the ratio so that when she's experiencing premenstrual syndrome, PMS, she's experiencing these symptoms even though if it were normal, she wouldn't have to.
So you're not saying that PMS is made up. It's a real thing.
Oh,
it just doesn't have to. It just means there's an imbalance somewhere.
Right.
That can be fixed, that you don't have to deal with this stuff.
Absolutely.
Okay.
Absolutely. And, like the weepiness, estrogen. Like estrogen is important for like our bone health, our cardiovascular health. Like it's the reason why we as women don't get heart attacks until after much later in life, because it's like it protects our hearts. It's important for our bone health, which is why when you experience menopause or perimenopause, it's very important to get your bone density checked. Yeah, so that's the importance of estrogen. And then like testosterone, which is produced by the egg, that's important for like sex drive, like being able to be aroused.
What happens in a woman's body when they're aroused that helps with implantation?
Yeah, so when the woman is aroused, that allows the cervix to sort of like pulsate so that when climax is achieved, the sperm can travel up into the uterus and, hey, let's get to the egg wherever it is. It also allows for the vaginal canal, which typically is around like 3 inches, which sounds crazy, but it actually lengthens and stretches. It's a muscle that moves to accommodate penis if you're having that kind of intercourse, or allow for artificial insemination in that way. So it like increases the likelihood of implantation successfully occurring. It's like,
I had no idea.
It's like so
Very
cool.
We'll pause so everyone can visualize.
Yeah, so our bodies are amazing, you know, like in order for conception to occur, it's like these, not only do the hormones have to cycle how they should, but you have to like address like your mental health. Are you in the space that you can have intercourse or whatever it is, you know? The ovary itself isn't even actually attached to the uterus. Like there's a gap between the two of them. And we have called chemotaxis, basically a chemical, like your body produces the hormones that attracts the egg to go down the fallopian tube as opposed to like staying in your abdominal area.
So every time you see a picture, it looks like
they're attached.
Yes.
But they're not.
So they have to let go and then actually be drawn up by the fallopian tube and then into the uterus.
Yes.
They're not attached.
No.
Huh.
I mean, we have connective tissue or fascia that's in that area.
Which helps kind of push it in the right direction probably, but...
Not exactly. It's more like it creates this compartment so that your uterus isn't like just floating around in your abdominal cavity.
Okay.
We have these connective tissue that like anchor it in that area. So then there's less likelihood that a fertilized egg will end up outside of the uterus, which is why ectopic pregnancies are so low in terms of their incidence.
Okay.
But then we also have like we have these finger-like projections in the fallopian tube that like brushes the egg along. So it's like not just the hormone that's attracting the egg to where it needs to go, and we have all of these other signaling processes that are occurring.
It's like I'm picturing, like a crowd surfer.
Yes,
like
totally.
we're kind of like pushing you.
Yes. We're all supporting you.
Pushing you in the right direction. Go this way.
Yeah.
Okay, cool.
Yeah. So that's what a normal cycle should look like.
Ideally, that's what it should look like.
Yeah, ideally,
So
that's what it should look like.
when a woman doesn't have her cycle.
When she doesn't have her cycle, then we have to consider 2 different things. Is it that she's not bleeding at all, which we call amenorrhea, or are there greater than the 35 days between each cycle, in which case we call that oligomenorrhea. So it's like many menses, kind of.
Okay.
Like technical term, but that's,
It seems like it'd be the opposite because it's
right.
There's a big space between.
Right. Yeah.
Yeah. Okay.
I know.
So either way, it's a problem, and that
Right.
will help determine how you treat it.
Yes. And so if it is that a woman isn't bleeding, so like amenorrhea, then we have to consider, why is that the case? Is it that she's pregnant? So that would be the first thing to assess. Is she pregnant? Okay, she's not. What's exactly going on? And so one particular condition that I've been hearing, or rather seeing more women experience, is called PCOS. So we mentioned it at the top of this segment, that PCOS stands for polycystic ovarian syndrome, or Stephen Leventhal syndrome. Basically, what's happening is that instead of the progesterone going up around day 14 to day 28, instead of it increasing, the body is changing it into another type of hormone. So just to give you some context, our bodies use cholesterol to make all our steroid hormones, which are all our sex hormones, as well as cortisol. So our bodies use the cholesterol and then turn it into pregnenolone, which is like the mother of all of those hormones. Pregnenolone can then become progesterone, it can become testosterone, It can become estrogen, which we have like 3 different types of estrogens, or it can become cortisol. In PCOS, what's happening is that instead of the pregnenolone going down to becoming progesterone, it's getting turned into either testosterone, estrogen, or cortisol. So a woman who potentially has PCOS or has been confirmed with that diagnosis, in addition to having amenorrhea, for her to be diagnosed with it, she also has to have 2 out of 3 things need to be met for her to be diagnosed. We have what's called hyperandrogenism, which is high testosterone. And so some of the symptoms she could experience would be like cystic acne or hirsutism, which is just a fancy term for hair in unwanted places. So like coarse, thick hair along your chin line or along your breast or in places that aren't typical areas that you have hair distribution. So that's that. And then the amenorrhea that we talked about. And then the last one is seeing cysts. So the only way that we can really assess if there are cysts in the ovary is that we do a transvaginal ultrasound. I say we, but not me, but like
right.
The actual tech would do that for you. And basically they place a probe inside the vaginal canal and they use an ultrasound on top of the abdomen to visualize if there are any cysts in the ovary. The reason why we get the cysts, so to back up again to looking at the cycle, instead of the egg being released, the egg just stays there because you need the progesterone to tell the egg, hey, release.
Stays where?
Stays in the ovary. So then the ovary itself, you have all these eggs that look like they're just about to release, but they end up forming what's called a cyst. So it can be either fluid filled. Cyst is just a fancy term for like a ball, kind of.
I didn't know a cyst could be an egg that didn't move.
That didn't move, yeah.
Oh. So when people say they've had ovarian cyst bursts,
it could be
an egg that didn't move.
Right.
Could be.
It doesn't have to be. It could just be fluid.
Okay.
Yeah, but in the case of PCOS, it's like the ovary doesn't release the egg. So it becomes mature, kind of, but not to the point where it actually releases because we don't have any progesterone or there's minimal levels of progesterone so that if and when a woman experiences bleeding, if she has PCOS, so long cycle or no bleeding at all, in the long cycle aspect of things, there's no egg. It's just blood or tissue that got to build up a little bit.
So the egg still is stuck in the ovary?
I mean, you could have some release at some point if her progesterone can get high enough that can occur, but it's like kind of like scattered. Like you can't really track it per se because it's like insufficient.
So she's having them just not, I guess besides have 35 days instead of 28, wouldn't most women just go, oh, that's no big deal, I just have a long cycle?
Well, the issue with having,
I guess, what are the other symptoms? So
what are the symptoms?
Yeah, like what else would they?
She could have the symptoms of PMS but never actually bleed. So she's still cycling, because remember, you're still cycling always, even if you bleed or don't bleed. So the hormones are still doing their thing. She can experience the PMS symptoms but not bleed, which means that she's not able to get pregnant.
Okay.
And even if, say, you don't ever want to get pregnant, or uterus is what I like to call, and other indies call it too, an emunctory. So an emunctory is basically an organ that our bodies detox or remove toxins. If we are not bleeding, that means those hormones are getting reabsorbed into our bodies, which for a woman, if she's estrogen dominant, it basically reinforces the estrogen dominance because she's reabsorbing it in her intestines, which make the symptoms worse.
Okay.
Because to get rid of our hormones, so like once they've done their thing and like we shed our lining and we bleed and what have you, the other way in which we get rid of our steroid hormones is by poop.
Oh.
I know. So if you're not pooping, then it's like...
Is that another symptom or side effect of one of these a cycle? Is it a cycle issue or not?
It could be a cycle issue, which one of the symptoms that women sometimes experience is like when they are on their periods, it's like either they're constipated or they have really loose stool, and that's because of hormones. Yeah.
Okay. They call it period poop.
Yeah.
I never knew why.
Yeah. It's because of the hormones.
Okay.
Yeah. Like, seriously, like...
So it's normal. If you're having a regular cycle and you have a day of like off, like poop that's not normal, it's just your hormones.
Yeah. It could just be the hormones.
It's normal.
Normal in the sense that to be expected with what you're experiencing.
Okay. Yes.
Yeah.
Okay.
Yeah. Other things that can happen with PCOS, and this is not with every woman. So some women gain weight, some don't. For a woman that does gain weight if she has PCOS, what's happening is that the body is converting the progesterone into like cortisol. And so like cortisol is the hormone that affects our sleep-wake cycle. So when you first wake up in the morning, the reason why you're fully awake is cortisol. Like it spikes at that point. What happens when we're under a lot of stress, or if you have PCOS, our bodies are making a lot more cortisol. And that cortisol allows for the breakdown of stored glucose and the conversion of other like protein and fat into glucose. The issue with that being happening for prolonged periods is that the woman can experience what's called insulin insensitivity. So her body is no longer able to respond to insulin, which means that when she eats, then she can't stabilize her blood sugar, which means that the sugar stays longer in the bloodstream, which causes damages to like small blood vessels and nerves, which is what happens in diabetes, which is why for a woman with PCOS, having metformin might work, which is why some doctors place a woman who is on PCOS on metformin to increase her chances of conceiving.
Okay.
Yeah. So there's this like, it's not just the hormones that affect your cycle. It's like hormones influence every aspect of our lives, from the moment we wake up and take our first breath to the moment that we pass on into the next life. It's this orchestra that each hormone has a part to play and influence each other in terms of how effectively each part is able to do their part.
Right. So let's say I came in and I had questions about my cycle. What's the first thing that a woman could expect? Like a blood work or...
So the first thing I would want to know is what labs she's already gotten done. So has she gotten her thyroid checked? And when I say thyroid, I don't just mean TSH, because TSH is just your brain telling your thyroid, hey, make the thing, you know? But also looking at the levels of the thyroid hormones, because you have two types of those. You have free T3 and free T4. And their ratio is also important. So thyroid function, CBC, which is just stands for a complete blood count, so checking for anemia. Because that could be another reason for amenorrhea. So like you're not bleeding because you're iron deficient.
Sure.
You know? And then I would also want CMP. So CMP is complete metabolic panel. And so that looks at the kidney and liver function, which are affected if blood sugar isn't being regulated effectively. Okay. And on the CMP, there's also a fasting blood glucose on there. So that would be like a first little, you know. I would also want to review her symptoms. So like, what symptoms are you experiencing? You know, are you experiencing acne? Are you experiencing bloating and irritability on your menses? Do you experience depression on your period? Because there's also the consideration that we have PMS and then we have PMDD, which is like premenstrual dysphoric disorder, which is basically PMS on steroids. It's basically like the period or the cycle overall is like so horrendous that the woman can't go to work. Like it's affecting her daily life, you know, like affecting her mental health. She's more depressed on her period, more irritable or really angry, or in so much pain that she can't leave her home. So then it's like looking at her as a whole person is like what I'm about, you know, and she's the expert in her experience. Right? She knows what it's like to walk in her body, to experience these symptoms, how they affect her life, and then both of us taking our expertise to work together to get to the root of why this is happening, and give the body the tools that it needs so it can rectify it.
You just reminded me that I need to make an appointment with you. I remember when I met you the first time, I was like, yeah, I need to see her. Because not only have I turned 40, but I know my hormones are changing, my periods are changing, like, just weird things happening in my body.
Yeah.
So how do people find you? What's the best way to get a hold of you?
Well, I am at Health for Life Grand Rapids, and you can check the website www.healthforlifegr.com, and you can look for my page, Dr. Gaynell Nave, ND, and there is a 15-minute free meet and greet and consult, so we can see if we're a good fit. I can hear about your concerns, and you can get the care that you need.
I love it. Thank you so much for joining us. We're going to have you on again.
Yes.
And we'll talk about some other intriguing topic. So again, thanks for listening. This is Ask the Doulas podcast. You can always find us at goldcoastdoulas.com. We are on Instagram, SoundCloud, and Facebook and Instagram. Remember, these moments are golden. Okay, so we'll add something about you saying that you have a blog when you mention your website. So just tell us, maybe just say, and you can find.
Okay.
So go ahead.
And you can find more about your cycle on my most recent blog post on the website.
So that's at
www.healthforlifegrandrapids. Well,
so Health for Life GR. Okay,
I think
so if you go to Health for Life GR, you'll find your blog posts.
Yep, and if you click on health articles, that's where you'll find it.
Perfect.
And it should be the one right at the top because it was just posted yesterday.
Perfect. Thanks.